Welcome to KidzDocTalk with Dr. Jennie. Today's guest is Dr. Pablo Anglas talking about the HPV vaccine. Dr. Anglas is a board-certified pediatrician and fellow of the American Academy of Pediatrics. He is a civil surgeon for the United States Citizenship and Immigration Services, vice chairman and chairman of Methodist Hospital Dallas, and medical lab director of MD Kids Pediatrics. He is the lead physician at MD Kids Wynnewood in Dallas, Texas.
Welcome to KidzDocTalk with Dr. Jennie. Dr. Jennie is a board-certified pediatrician and is the director of telemedicine at Pediatric Associates.
Hi, Dr. Anglas. Welcome.
Thank you very much for the invitation. It's a pleasure and an honor to be here.
Oh, good. I'm happy to hear that. We're going to talk about a topic that's actually very important and I think very relevant right now, which is HPV and the vaccine against HPV. So to start off with, what is HPV and what conditions is it associated with?
Well, HPV is it started with a study of viruses. It's a DNA virus that can be easily contracted by the patient that is being exposed to any lesions. Can be easily contacted by mouth-to-mouth kissing, by oral sex, skin-to-skin contact, or intercourse.
And even though it's a virus, right, unlike other viruses, it's actually associated with some pretty serious medical conditions, right? What kinds of things do we usually see associated with it?
So what we see is during this infection, the virus easily can get into the skin or the mucosa, and we have related conditions like warts, condyloma acuminatum, and early cervix uterine lesion that lately can be turned into cancer.
So I think that's an important takeaway for me because that really makes HPV, I think, very unique. There's not a lot of viruses associated with cancer, right, or with malignancy. So this one, is a little bit unusual, which I think makes the vaccine very, very important and critical to talk about. So the vaccine I sort of think of as being relatively new compared to the other childhood vaccines. Tell us a little bit about the history behind it. When did the vaccine come out and what patients is it meant to be for?
Well, we have updated the information on HPV since 2006 that it came, and it was available by 2007. That's what we have, and we were really very excited and ready to give the vaccinations to our patients, but there were some political and some patients were not ready to go with us, but we were ready since 2007.
And what patient population is it really meant for?
Well, what I have that time around 2008, I have patients coming for regular checkups, and I got the shot record for patients from New England, from Rhode Island, that got the HPV, and they were boys. And I said, wow, we didn't know that time that the indication was not only for girls 9 and up, and for boys also. That's what we have now, the indication for starting at 9, but for sure at 11 and for teenagers.
Is there ever a time for, the audience here is primarily parents and caregivers, but also for my own education, is there like an age cutoff where someone is too old to qualify for the vaccine?
Well, what happened with is the research and what is being approved by usually CDC and FDA, I think the study stopped by 18 years. They moved it a little bit to 21. There was not indicated for older than 21 because of the research, because of the papers that were presented for the authorization. But now we know that patients can get it later, even older than 27.
Wow. So how effective is it? Because we'll talk a little bit about the hesitation and the discomfort people may have around it. But I first want to talk about why we think it's important. What's the efficacy of this vaccine?
Well, what I'm seeing and I'm reviewing, it varies because it can protect for cancer up to 80% of the teenagers and 70% on the adult population. So it's very, very effective controlling cancer. Really, it's a vaccine against a virus, and that's what I tell my patients. We are protected. It's an investment on your child not to be infected, not to have cancer later in life.
So, what do you say to parents? Because I've had this happen where I offer the vaccine, I recommend the vaccine, and they say, you know what? It's a virus that is primarily sexually transmitted. My child is not sexually active. We don't need this vaccine. How do you approach that?
Well, what I say is, as I read, is it can be early infected by mouth kissing, by skin-to-skin contact, by oral sex, and later with intercourse. So what I know is a person can be infected very early in life. The virus gets into the body. It's a DNA. It's like our DNA gets embedded into the cells, and it can be dormant day for years, and later in life produce these warts and the cancer.
So this is really, I like the word that you said, investment. It really is an investment early on, right? Regardless of what decisions that the child or the family is making, because when they're in adulthood and they potentially are exposed to this virus, having the vaccine early on is really hugely protective against development of cancer and malignancy.
Yes, it is, and that's what I said. Is it very important because we'll talk later about the myths of this, but is it very important to start very early in life? I told them even before they are thinking about any exposure, it is better to have the shield early on life.
So we know nothing is risk-free. There's certainly side effects, and right there's certainly always things to think about with any kind of medical intervention. So now let's talk about the risks and side effects. What types of things are truly we know is associated with vaccine?
Well, we haven't seen major side effects. What I've seen is local reaction, sometimes pain, and 1 or 2 days later they call we have a rash, a very redness over there. We just watch it and give some medication for the pain, for the inflammation, can be acetaminophen or ibuprofen. We haven't seen much. What I've seen is sometimes kind of dizziness
Mhm.
and fainting episodes. There is something that we are approaching our clinics very seriously. The child, the patient should stay very well seated down, stay there after the shot for 10 or 15 minutes. I told them don't even move to the chair. So to avoid these collapses or dizziness, that's all I've seen. I haven't seen any major effects.
Yeah, I would agree. I think that what we think is sort of a vasovagal, right? That kind of dizziness and you're a little bit of a disorientation after the vaccine. And usually we just watch the kids in the clinic for 10 to 15 minutes after the administration and they're fine. So now let's talk about myths because there's all sorts of things. There's like a new article every day about someone who got the HPV vaccine and now they're paralyzed, right? Or now they have some sort of debilitating illness. And this is I'm not sure the sources of these, but let's talk about myth because I think there's a lot of discomfort surrounding this vaccine because of the myth around it.
It is that what we've seen is, as any other vaccines, new vaccine shots, what I have review is sometimes they think it's not effective, and yes, it is. It goes to 80 to 7% of effectiveness, not to get warts or cancer. So that myth is not valid, and it can cause infertility. Has nothing to do with infertility, really. The studies are there, and they on the other way they are protected to have a healthy life. And the other one is that I don't need it. Yes, you need it because it's important. The research is there, the giving protection. I can tell you for personal experience, as you can tell, I'm from South America, I'm from Peru, and we have seen on early patient, the 2021, with a spread uterine cancer. going to the liver, to the lungs. And at medical school, we used to see those tumors protruding from the vagina, that is cervical cancer. And we don't see this now. So it is important to let know our medical students, our residents, that they are not seeing these lesions anymore. It really protects, and you need it.
I think those are important. I've seen a lot of fallacy around the long-term consequences of this vaccine, and like I said, some sort of debilitating neurological condition, which we know, of course, is not associated with the vaccine. Just like we know autism is not associated with any vaccine, right? It just sometimes that's how the timing of things evolve, and so people like to link the two together. So this vaccine you said has been out since 2007, right? Is really when it first came on the market. So countless doses, I'm thinking at this point, have been given. And so if there was really any true concern for, consequence or any debilitation, it would be taken off the market. Is that fair to say?
Yes, it is. And it was at the beginning was already approved, but then there were some changes and we had to change the schedule. But now we are highly recommended, started at 9 for boys and girls.
Is there any benefit to giving the vaccine or introducing it early, right? Because it's indicated from the time that children are 9, but I know right in our practice we offer it at 9, but there's always a right chance to get it when they're later. We try again at 11, right? Try again at 13 if they haven't accepted it yet. Any benefit to getting it early?
I think it is, the benefit is there. It is. The earlier, the better. We don't know when are they going to be exposed, when is going to happen. So I think, as I said before, it's a shield protecting our boys and our girls early in life. So it is better. And as we say, probably under recommendation, if it's early, we can be that's only 2 vaccines, 6 months apart. So it is better to go that route. 11 to 12, maybe they're gonna need 3 vaccines.
What are the intervals between the doses right now?
For younger ones, it's 6 months apart for 9 to 11. And for 11 to 12, it will be 3 shots, starting at 0, and the other one can be 2 doses later. Two can be at 2 months and 6 months later.
What do you say to parents who are right, maybe accept all of this, say, okay, I understand it's an important vaccine, it's going to protect against a virus that's associated with cancers, but I'm nervous. I'm still nervous. What would you say? What are like some main takeaways that you really want families to know to increase their comfort about this?
Well, what I learned about along these years, I tell them, and they agree with me. I told them, I giving it to my girls. I get my 9-year-old, my 10-year-old, my 11. They got their shots and nothing happened. So they look at me like, oh well. So I think it's an important message, letting them know that my close relatives got the vaccine and say, oh well. So sometimes they make them change their mind.
I love that. Okay, fantastic. Anything else? Any main takeaways or anything that you want families to know about HPV or the vaccine?
Well, again, as the vaccines, there are some beliefs and reluctant to get vaccinations, and I told them that I agree with that. I don't share this, but for many reasons, political, I don't know, sometimes religious or for thoughts, I told them, you are going to still be my patient. I want you to know that I'm with you. I'm recommending something that is going to be a benefit for your kids. Again, I respect your decision. I don't share it, but if you change your mind, get the information and you can come back anytime. We're here for you.
I love that approach. I love that approach. I think that's fantastic. And that really, I think, encourages families to ask questions, right? We don't just want people to do it because we say to do it. We want people to ask questions and do some shared decision making and be comfortable with the recommendations that they're taking from us.
Yes, I agree with that. And the other one is regarding boys. They say that the boys don't need it,
Yeah.
and I told them that yes. I was trying to look into the research that some populations that increase or improve circumcision on boys, it is what really in the smegma can be carrying the HPV. Population of circumcised male have less risk of cancer of the uterus of the cervix. So I think that's an important message, because the boys can be the carriers.
The boys can be the carriers and can also be affected, right? Because we know that it's associated with anal cancers. It's associated with cancers around and on the vocal cords, right? And unfortunately, that HPV doesn't discriminate genders,
Correct.
and right, everyone is unfortunately at risk.
I think we have the opportunity to talk to them. On the early months of the pandemic, I was able to do telemedicine from home. And I have the opportunity to talk to them a little more extended during the telemedicine appointments. So I think it's going to be a great tool to let them know that we are here presentially or telemedicine, to let us know and give them the benefits, all the vaccinations or healthy life and sports and everything. So I'm very excited with the post and telemedicine.
Excellent. Thank you for that. Well, listen, thank you so much. This has been great. I'm really appreciative of the time that you took to talk to us about this important topic.
Thank you to you. I'm happy to be here anytime. Thank you for the invitation and happy 4th of July.
Thank you. You too.
Goodbye. Thank you.
Make sure you like us on Facebook and follow us on Instagram and Twitter. Thank you for joining us on Kids Doc Talk.